Welcome, everyone, to the very first session of MedSimu Anatomy Podcast. I'm really excited to be guiding you through this initial deep dive. We're tackling something fundamental today, anatomical terminology. It's basically the language of medicine.
Yeah.
And helping us navigate this is an expert in the field. Welcome.
Thanks for having me. I'm genuinely looking forward to this.
hmm
It's surprising how nailing these basic terms really clears things up later on, even in complex cases.
Absolutely. Think of it like this, everyone. This is your essential toolkit, your lexicon. Without a good handle on these words, for body relationships, limbs, joint movements, even the bumps on bones communication, it breaks down. Diagnosis gets harder.
That's so true.
So yeah, we'll be covering all those categories today.
Exactly. We'll start with those descriptive terms, the ones that tell us where things are in relation to each other, spatially.
Right.
Then we'll shift to the limbs because, well, they have their own special vocabulary.
Upper and lower limbs, right?
Right. And after that, we'll get into movement, all the ways our joints let us, move. And finally, we'll touch on the terms for bony features, the little landmarks on the bones themselves.
Okay, sounds like a solid plan. Let's kick off with those descriptive terms for body relationships. These are the ones that give us our bearings, yeah.
Precisely. Let's start with the basics.
Yeah.
Directions, you'll hear anterior and posterior all the
Yeah.
time. Anterior just means towards the front. Think about your pecs. They're on the anterior chest.
Front side?
Yep. And posterior is the opposite towards the back, like your traps, your trapezius muscle.
Got it. Anterior front, posterior back. What about up and down?
Good question. That's superior and inferior. Superior means towards the head or cranial sometimes, basically above. So your skull is superior to your collarbone, your clavicle.
Okay.
And inferior means towards the feet or caudal, below. Your heel bone, the calcaneus, is inferior to your talus, the ankle bone just above it.
Superior up, inferior down. Seems straightforward. How about central and peripheral? How do they fit in?
Central refers to things closer to the body's core, the main axis. The spinal cord is a perfect example, very central.
Right, in the middle.
Exactly. And peripheral is for structures further away from that center, like the nerves spreading out into your arms and legs.
Okay, center versus edges, basically. Now, you mentioned the midline earlier. There are specific terms for that, too.
Yes, and these are really important. Median means right on the midline, in that plane dividing the body into perfect left and right halves, the mid-sagittal plane.
Directly in the middle.
Directly. Then medial means towards that median plane.
Posterior to the middle.
Yep. And lateral means away from the median plane, towards the side. Think about your forearm again. The ulna, that's the pinky side bone, is medial. And the radius, the thumb side bone, is lateral to the ulna.
Medial towards middle, lateral towards side. Makes sense. What if something's stuck between a medial and a lateral structure?
Good one. That's intermediate. It literally means between. In the foot, you have 3 cuneiform bones. The intermediate cuneiform sits right between the medial and the lateral ones.
Okay, intermediate for in between. We also hear external and internal. How are they used?
Right. These generally relate to proximity to the body's center, often within, say, an organ or a body cavity. The external intercostal muscles, for example, are closer to the surface than the internal intercostals.
Makes sense from the name.
Yeah. And your stomach is internal to your abdominal wall.
So external, internal, often about layers or cavity position. Now, superficial and deep also sound like depth. Are they the same thing?
Close, but there's a key difference. Superficial and deep are always relative terms, and they specifically relate to the body's surface.
Ah, okay. Relative to the surface.
Exactly. You'd say the skin is superficial to the fat beneath it. Or a nerve might run deep to a particular muscle. It's always comparing two things based on how close they are to the outside.
That's a crucial distinction, especially for imaging or surgery.
Absolutely critical. Understanding those layers is key.
Okay. Now, what about ventral and dorsal? Where do they come in? I hear those sometimes.
Yeah, you do. Ventral means towards the belly side, and dorsal means towards the back side. In humans, standing upright, they pretty much line up with anterior and posterior, respectively.
So ventral is like anterior, dorsal like posterior.
Mostly, yes.
Ah,
But the terms are useful because their original meaning is clearer if you think about, say, a dog. The ventral side faces the ground, dorsal faces the sky. You'll also see ventral and dorsal used a lot in embryology, describing the developing embryo.
okay. Developmental context matters.
It does. And lastly, for directions, we have cranial and caudal. Cranial means towards the head. Sometimes you'll hear rostral, especially for things in the head near the nose.
Cranial towards the head.
And caudal means towards the tail. In humans, that's basically toward the bottom of the spine, the inferior end.
Tail end, yeah.
You'll hear cranial and caudal used a lot clinically, like describing where a finding is along the length of the spine or the body.
That's a really comprehensive list of directions. You also mentioned some other general terms like invagination and evagination. They sound like shape changes.
They are. Invagination is an inward folding or pushing in. Like if you poke your finger into a soft balloon, the dent is an invagination. Happens a lot in development when tubes form.
Okay, folding inwards.
And evagination is the opposite, an outward bulge or protrusion. Think of like a diverticulum pouching out from the colon wall.
Pouching outwards, got it. And then ipsilateral and contralateral.
Yeah, those are pretty simple but useful. Ipsilateral just means on the same side of the body.
Like right arm, right leg.
Exactly. They're ipsilateral. And contralateral means on the opposite side. Your right arm and your left leg are contralateral.
Same side, opposite side. Easy enough. Seems very important in neurology, maybe.
Definitely, when you're assessing symptoms that only affect one side of the body.
Right. Okay, let's switch gears to the limbs. You said they have their own special terms.
They do, because, well, their main axis is different from the trunk's axis. So for both arms and legs, we use proximal for closer to the trunk attachment point.
Closer in.
Yep. Your elbow is proximal to your wrist, and distal means further away from the trunk. Your wrist is distal to your elbow.
Proximal near the body, distal further out. Okay.
Now, specifically for the upper limb, the arm, we use terms related to the forearm bones. Radial means towards the lateral side, the thumb side, where the radius bone is.
Radial matches radius, thumb side.
Correct. And ulnar means towards the medial side, the pinky finger side, where the ulna is.
Ulnar matches ulna, pinky side.
You got it. You might also hear preaxial border for the outer radial thumb side and postaxial border for the inner ulnar pinky side.
Preaxial outer, postaxial inner on the arm.
Yeah.
Okay. What about front and back surfaces?
Good point. The flexor surface of the upper limb is generally the anterior surface, the front. Where your biceps are, the muscles that bend the elbow.
Flexor surface, front.
And the extensor surface is the posterior surface, the back, where your triceps are.
Extensor surface, back.
And one more for the hand. Palmar, or sometimes volar, refers specifically to the front of the hand, the palm.
Palmar volar for the palm. Okay. So how does this apply to the lower limb? Similar ideas.
Similar logic, yes, but with a really important twist because of how the legs rotate during development.
Mm-hmm.
Proximal and distal work the same way. Your knee is proximal to your ankle.
Mm-hmm.
Your ankle is distal to your knee.
Same concept. Closer, further from the hip.
Exactly. But instead of radial and ulnar, we use tibial for the medial border, the big shin bone side, the tibia.
Tibial for the inside, like the big toe side.
Right. And fibular for the lateral border, the side with the smaller fibula bone towards the little toe.
Fibular for the outside. Okay. Now what's the twist?
Here it is, the borders. In the lower limb, the preaxial border is the inner tibial side.
Wait, preaxial is inner on the leg. It was outer on the arm.
Exactly. And the postaxial border is the outer fibular side. It's flipped compared to the arm.
Huh. Why is that?
It reflects that rotation the lower limbs undergo during development. It's a key difference.
Wow. Okay. Preaxial inner tibial, postaxial outer fibular on the leg. Need to remember that flip. What about surfaces?
Also different orientation. The flexor surface of the lower limb is generally the posterior surface, the back, where your hamstrings are.
So flexor is back on the leg, not front like the arm.
Correct. And the extensor surface is the anterior surface, the front, where your quads, your quadriceps muscle group are.
Extensor is front on the leg. Man, that rotation really changes things.
It really does. And finally, for the foot, the sole is called the plantar surface.
Plantar for the sole. Got it. Remembering that prepostaxial switch and the flexor-extensor surface flip is key.
Absolutely. It actually helps understand some nerve pathways later on, too.
Fascinating. Okay, let's move to describing movements. This is all about what the joints can do, right?
Exactly. And movements happen in specific planes around specific axes. Let's start with flexion. Generally, it's a movement, usually in the sagittal plane, that decreases the angle between bones at a joint.
Bending, making the angle smaller.
Right, like bending your elbow. You bring the anterior surfaces of your forearm and upper arm closer.
Okay, but you said generally. Are there exceptions?
There are. The knee is a big one. Knee flexion decreases the angle, but it brings the posterior surfaces closer together.
Ah, bending the knee moves the calf towards the back of the thigh, right?
Exactly. And the ankle has its own special terms. Lifting your foot up toward your shin is dorsiflexion.
Dorsiflexion, foot up.
And pointing your toes down like a ballerina is plantar flexion.
Plantar flexion, foot down. Okay.
We also have lateral flexion, which is just bending the trunk sideways. in the coronal plane.
Sideways bend. Got it. So flexion decreases the angle, direction depends on the joint. What's the opposite?
That would be extension. Also, typically sagittal plane, it increases the angle between bones, moves the extensor surfaces apart.
Straightening the joint.
Yep, straightening your elbow, straightening your knee, those are extensions.
And hyperextension.
That's going beyond the normal straight anatomical position, increasing the angle past 180 degrees, like tilting your head way back or arching your back.
Going past straight. Okay. What about moving limbs side to side?
That's abduction and adduction. These happen in the coronal plane. Abduction is moving a limb away from the body's midline. Think abduct, take away, like raising your arm straight out to the side.
Abduction away.
And adduction is moving the limb back towards the midline. Think add it back to the body.
Adduction towards adding it back. Good mnemonic.
It helps. For fingers and toes, abduction is spreading them apart.
Okay.
And adduction is bringing them back together. Thumb movements are a bit unique, more complex. We can save those maybe.
Sounds good. What about twisting movements? Rotation?
Exactly. Rotation is turning around the long axis of a bone. We have medial rotation, also called internal rotation, that's turning inwards, so the anterior surface faces more towards the midline, like rotating your shoulder to bring your forearm across your belly.
Turning inwards. Medial rotation.
And lateral rotation, or external rotation, is turning outwards. The anterior surface faces away from the midline, like rotating your shoulder outwards.
Turning outwards.
Oh, yeah.
Lateral rotation.
Okay.
And circumduction. Sounds fancy.
It's a cool one. It's like drawing a cone shape. It combines flexion, extension, abduction, and adduction, all in sequence.
Whoa.
You see it at joints that can move in multiple planes, like the shoulder and hip. Ball and socket joints.
So like swinging your arm in a big circle?
Kinda, yeah. A classic example is like a cricket bowler's arm action. That big wind-up and follow-through involves circumduction.
Great visual. Now the forearm ones, supination and pronation. Always get those mixed up.
You're not alone. Let's clarify. There's specific rotations of the forearm and hand. Supination is the lateral rotation that turns your palm to face anteriorly, or upwards if your elbow is bent. Think of holding a bowl of soup.
Supination, palm up. Okay, that helps.
It does. And pronation is the medial rotation, turning the palm posteriorly, or downwards, palm down.
Pronation, palm down. Got it. Sup helps. What about foot movements? Inversion and eversion.
Right. Inversion is moving the foot so the sole faces inwards medially. Kind of like rolling onto the outside edge of your foot.
Sole inwards, inversion.
And eversion is the opposite. The sole faces outwards, laterally, rolling onto the inside edge.
Sole outwards, eversion. Important for ankle injuries, I bet.
Very important for understanding ankle sprains, yeah.
Okay, nearly there on movements. Protraction, retraction, elevation, depression.
These are pretty intuitive, usually involving the jaw or shoulder girdle. Protraction is moving forward, parallel to the ground, like jutting your jaw out.
Pushing forward.
Retraction is pulling it back.
Pulling back.
Elevation is moving upwards, like closing your jaw or shrugging your shoulders up towards your ears.
Moving up.
And depression is moving downwards.
Yeah.
Opening your mouth or letting your shoulders drop down.
Lowering down. Okay, that covers movements nicely.
It's quite a list, isn't it?
It is. Finally, let's talk about bones. They aren't just smooth, right? They have all sorts of features.
Not at all. Bones are covered in bumps, grooves, holes, facets, all sorts of landmarks. And they're there for a reason. Muscle attachments, joint surfaces, pathways for nerves and vessels.
So how do we talk about them? Are there categories?
Yeah, we can broadly group them into, say, depressions and openings, and then projections or processes, the sticky out bits.
Okay, let's do depressions and openings first. What are some common ones?
Okay. A foramen, that's just a hole, usually for nerves or blood vessels to pass through, like the big foramen magnum at the base of the skull.
Foramen hole.
A fossa is a shallow depression or hollow. Think of the glenoid fossa on your shoulder blade where the arm bone connects.
Fossa, shallow dip.
A groove, sometimes called a sulcus, is like a ditch or channel. Often holds a tendon or vessel. The bicipital groove on the humerus is a good example.
Groove channel.
A meatus is more like a tube-like opening or canal. The external auditory meatus, your ear canal, is a classic one.
Meatus canal.
Podosinus, talking about bone, is an air-filled cavity inside the bone lined with mucous membrane, like the paranasal sinuses around your nose.
Sinus, air cavity.
And a facet is usually a small, smooth, flat area where bones articulate, where they meet, like the facets on vertebrae where ribs attach.
Facet, small, flat joint surface. Got it. So those are the dips and holes. What about the parts that stick out, the projections?
Right, the projections are processes. These are often for muscles and ligaments to attach to, or they form parts of joints. A condyle is a rounded, knuckle-like projection, usually part of a joint, like the big condyles at the bottom of your femur or at the knee.
Condyle, rounded knuckle for joints.
An eminence is just a projecting, prominent part, often smaller than a condyle, like the intercondylar eminence on the tibia between the condyles.
Eminence equals smaller projection.
A head is typically a large, rounded end of a bone that fits into a joint, often set off by a narrower part called a neck, like the head of the femur in the hip joint or the head of the humerus in the shoulder.
Head, rounded articular end with a neck.
A crest is a prominent ridge or border, like the iliac crest you can feel on your hip bone.
Crest, upper ridge.
An epicondyle is a projection situated on or above a condyle, often for muscle attachments. The bumps on either side of your elbow are epicondyles of the humerus.
Epicondyle bump near a condyle.
A line, or linea, is a low ridge, less prominent than a crest, like the linea aspera on the back of the femur, a big site for muscle attachment.
Line, low ridge.
A spine is usually a longer, thinner, often pointed projection, like the spinous processes sticking out from the back of your vertebrae.
Spine, sharp, pointy projection.
A trochanter, this term is specific to the femur. They are very large, blunt projections for powerful muscle attachments. The greater and lesser trochanters near the hip joint.
Trochanter, very large bump, only on femur.
A tubercle is a small, rounded projection, like the greater and lesser tubercles on the humerus near the shoulder.
Tubercle, small rounded bump.
And lastly, a tuberosity is a large, rounded, often roughened projection, also typically for muscle attachment, like the ischotuberosity, the bone you sit on.
Tuberosity equals large, rough bump. Wow. That's a lot of specific terms just for bone features.
It is, but knowing them is incredibly helpful. It makes describing locations or understanding injuries much more precise.
Absolutely. You can see how vital this vocabulary is for anyone reading anatomy texts, looking at x-rays, MRIs, or even just communicating with colleagues.
Exactly. It's the shared language that lets us be precise about the body's complex structure.
Well, this has been just fantastic. A really thorough first look at this foundational anatomical terminology. We've really covered a lot. Directional terms, the special language for limbs, all those joint movements, and now these bony features. It's really clear that having a solid grip on this vocabulary is, well, it's non-negotiable for anyone going into medicine or related fields.
Completely agree. You can't build a strong house on a shaky foundation, right? Mastering these terms is that essential first step for understanding anatomy and physiology.
So for all of you listening, I really do encourage you, go back over these terms, practice using them, try to visualize them. Building this foundation now will make tackling more complex anatomy so much easier later on, and of course it's critical for your board exams.
Couldn't have said it better myself. It's about building that clinical competence from the ground up.
Our next deep dive is going to build directly on this. We'll be exploring the skeletal system in more detail using the very language we've set up today, so we really hope you'll join us for that.
Sounds great. I'm looking forward to it.
Thanks again for sharing all your expertise today. And thank you all for tuning into this first session of MedSimu Anatomy Podcast. We look forward to meeting you again for our next deep dive into the amazing human body.